President Biden yesterday made a push once again for more Americans to get vaccinated against COVID-19. This in light of the recent Delta variant that, according to the CDC, is now accounting for more than half of the current coronavirus cases here in the U.S. And joining us now to talk more about this is Dr. Bob Lahita, director of the Institute for Autoimmune and Rheumatic Diseases at St. Joseph Health. He is also professor of medicine at Rutgers and New York Medical College. Dr. Lahita, welcome back. Great to be with you again. So what can you tell us about this Delta variant? Is this strain more dangerous or more contagious? And should we be worried about it?
Well, the Delta variant, Tracy, is just another mutation. We've had a lot of them, and they're all now with Greek letters. There's the new one, which is the Lambda variant out of Peru. And that's an example of the RNA that really is at the center of the coronavirus. And this RNA changes its character periodically, meaning that the spike protein will have a different stereochemical structure. So consequently, the immune system sees it as a totally different animal, a variant, as it will. However, the vaccines are very effective. The J&J, the Moderna, and the Pfizer vaccines are all very protective against the Delta variant, which is out of India, by the way. I don't think I said that at the beginning. So this is really interesting because this is 60% more transmissible to people, and it causes a more severe condition to those people who are not vaccinated. And it's particularly virulent in young people. They get an atypical kind of a syndrome, and some of them get quite ill. And we're seeing that in parts of our country now, like Missouri, Springfield, Missouri to be exact, where the virus has taken hold, and there have been an increased number of deaths over the past 24 hours. Tracy.
And Dr. Lahita, another thing that we're hearing also about is this Lambda variant in Peru. What more do you know about that, and how concerning is that to you?
It's not very concerning to me because I know that if you're vaccinated, you're protected. The Lambda variant, again, is just another mutation that occurs in the viral RNA, altering the structure of the spike protein. So we've not gotten big data on that yet. There's genomic analysis throughout the country, but it's not very prevalent in the United States. The Delta variant, on the other hand, is in every state. It's in all 50 states of the country. Now, for your viewers, let me just explain that if you have on your computer a paragraph and it makes a lot of sense and you understand it, and then all of a sudden you alter a couple of those words, that's a mutation. And that changes the whole meaning of the paragraph. It may make sense, it may not make sense. And that's what it does to the immune system. That's what a mutant does to the immune system. And that's when it changes its character. And of course, the immune system, for all intents and purposes, recognizes it. And your vaccine is extremely protective against most mutants. Now, I can't say that's 100% because we've got mutants coming down the pike, but that's what viruses do, Tracy.
Well, Dr. Lahita, we have probably about a minute or so left. One thing I want to ask you about, and this recently came out just a few days ago, Singapore announced that it's going to start treating the COVID-19 cases really essentially like the flu. And they're going to stop counting all the cases. Do you think that this is something that we're going to see across the board eventually, that maybe all countries are going to end up treating COVID-19 like the seasonal flu?
Yes, I think that's possibly going to be the case. Not because it's very laborious to do these case counts, et cetera, and try to figure out the epidemiology and genomics in every state all throughout the year. I have said before that I think this virus may become endemic, which means that we may require boosters either every year or every 2 years, or perhaps even longer, because these vaccines are very efficacious. So yes, I do think that's going to be the case going forward.
All right. Well, Dr. Lahita, thank you so much for your time. So much more we could talk about, but we have to leave it right there. Thank you again.
Thank you, Tracy.